At the moment, SHA has a package of 800,000 for treatment of cancer, and that should be a motivation that if you are sick, then you must be treated. Nobody, no woman should die. No woman should die out of a preventable disease. No woman should die when we can vaccinate the girls early. No woman should die when the disease is treatable. It can be prevented, it can be detected early, and it can be treated. Therefore, I am calling upon everybody, every other woman, to make sure that they present themselves to any health facility, and especially the public ones, so that they are able to get vaccinated. Either the girls are vaccinated, the women are getting screened, and those who are already unwell, they should get treated. Kenya is very committed to the global goal of eliminating cervical cancer as a public health problem. And as I have highlighted before, 90% of HPV vaccination to our young girls who are below 14 years, screening, voluntary screening for our women between the ages of 25 and 49 years. And that takes 70% of that if we are able to screen them. And equally 90% treatment of all the cervical cancer cases that are presented in our facilities. Therefore, we are very committed to the goal of eliminating cancer as a public health problem. And as a government, we have been able to launch the National Cervical Cancer Elimination Action Plan of 2025 to 2030, and that's a plus. Cervical cancer is affecting many women in different ways, and one of it being the social and economic concern, because when it affects women in their most productive years, then the productivity, whether it is in regards to children or economy, it goes down. And again, many patients are mothers and caregivers. Many patients are women who have children who are going to school. Many patients are women who are at their early age of production. They have husbands. Therefore, it really impacts on families and the livelihoods of ourselves and the community at large, that women must go for screening. Let's hit the 70% of all our women who are going to facilities to get screened. And especially this month, when it is the Cervical Cancer Awareness Month, we are really calling on all our community health promoters. When they go to the households, you find a woman, remind her that it is the month that they need to go for screening. Cervical cancer is a serious but preventable disease, and going by statistics, it is the second leading cause of cancer deaths among women in Kenya. And almost 6,000 women are diagnosed every year, and more than half of those women die because of the same. And why do these women die? It is because of, one, late diagnosis, because cancer cervical cancer develops very slowly and can be detected early through screening. Therefore, it is my prayer that going with the WHO standards, that we are going to meet the 90% set for vaccination of girls and 70% of screening of the women. In Kenya particularly, we are not even half of screening our women because we are below 50%. Most women do not go to hospitals. Most women are not getting screened. And we also want to go at 90% treatment. HPV vaccination protects girls early, and HPV vaccine prevents cervical cancer and is very safe and effective. There has been a lot of talk here and there and a lot of hullabaloo around it. But I want to confirm to the members of public that HPV vaccination is very, very safe. As long as it is coming from the Ministry of Health, then that is a safe vaccination. And Kenya has piloted a HPV vaccination in 2013 to 2015 in Kitui County. And the product was good because we got 89% community acceptance. And we also got 96% uptake. Murimu uyu wa cervical cancer ni murimu very serious, no ni murimu ungirigiririrwa. Na nikio turauga murimu uyu wa cancer ni murimu wa keri uria uragaga atumia maingi Kenya. Na kumania na atumia mangikinya nginya 6,000 aria mathiaga thibitari nimo makoragwo magituika diagnosed o mwaka ati Kenya ni tukoragwa na atumia mathiete thibitari makerwa wewe uko na cancer makubiriritie 6,000. Atumia acu nuthu yamo ni makuaga. Na makuaga niki? Makuaga tondu murimu ucio ukoragwa wikarite mwiri-ini muno nginya ugakinya bandu ba stage iria itangicokwa na thutha ni undu wa late detection. Riu ugakoraga ni mathi thibitari, yes, na ni mekwa screening, ni monekana mena cancer, no makerwa ona matritwa murimu ucio utingicokwa thutha. Nikio turoria atiriri, cancer ya murimu wa cancer ya nyomba ya atumia ni ngagira thiini wa miri ya atumia very slowly kana kabora mundu ndamenyaga ikingira. Na nikio turakinyiriria andu ni mathi makarorwe tondu screening niyo yagirirwe ni gukorwa ya mbere. Na tukauga twana turia kana tumwiritu turia tunini turia twina miaka 10 nginya miaka 14 ni mathima mundu sindano iria iretwa ya HPV vaccination niguo magiriririe cancer kuingira thiini wa mwiri wao. Na tugacoka tukauga turenda thiini wa Kenya twiritu tuna 10 years to 14 years ni turenda tunyite kana tubote gukinyira 90% of those girls. Na atumia aria marathi screening tukinyire atumia 70%. Na tucokerere atumia aria marwarite 90% of them no nginya mathondekwe na makorwe magicoka mawirani mao. Murimu uyu wa cancer no koragwa unyitite atumia uru muno na magakorwa ni maracoka na thutha muno socially na economically. Tondu riu amwe ni memenaga ni undu wa gukorwa mena murimu ucu na ringi atumia yani aria me in their productive years, either mutumia ucio na twana tu cukuru kana ni mutumia ena muthuri na ni mutumia between 25 na 49 riu ugakoraga ni memena muno marwara at that productive age na magakoragwa pia matirathi wirani wao uria magirwe ni gukorwo makithi. Korwo ni wendagia ni waburaga biathara kana ugakorwa no we mwandiki wa thirikari, we mwandike ni thirikari, ugakoraga ona andu aria binafsi we mwandike niyo ugakora ndurabota kuthi wira wega tondu uturaga clinics. Koguo ni turauga ni tunyitanire niguo murimu uyu tubote tukubura thiini wa miciini itu. Na ni ndirenda kuga ati ona kigina kana SHA ina kigina kiayo, kigina kia 800,000 gia kuthondeka andu aria mena cancer. Koguo mundu ndagakire ona wero wina cancer uthi thibitari niguo thondekwe, no thondekwe nebenya na mbere makiria uthie screening. Ni ndirenda kuria CHPs maitu me maturani ni mathi o mucie kuria megukora atumia mamere mweri uyu witagwa Cervical Cancer Awareness Month. Atumia acu ni maumire na ni mathi makathimwe na ona kuria Ngiriambu kwina screening igakorwo egikika kumagia Monday ya mweri 26 nginya Friday ya kiumia kiu. koguo nĩ ngwĩta andũ monde arĩa maumĩte kũrĩa Kĩrĩnyaga nĩ mathii magekwe screening kana atumia mathii magekwe screening ya cervical cancer. Thank you. Tumalizieni hapo.